Hello everyone, today we'll learn about the fatigue. So let's start the fatigue. Now what is the fatigue? When the muscle is stimulated repeatedly for a prolonged period of the time, it loses its physiological property of the contraction, and such type of the phenomenon is known as fatigue. However, it regains its property of the contraction after the some period of the time. Fatigue, which is due to weakness and exercise intolerance, is occurs due to decreased cardiac output that causes the tissue hypoxia, and the exercise intolerance occurs due to the one reason is decreased perfusion of the skeletal muscle, and second reason is decreased oxygen supply to meet the need of the body. What is the procedure for the fatigue? For that, first of all, we have to set up a nerve muscle preparation, and stimulation and recording a system is for the simple muscle twitch. For that, we have to draw a baseline and mark the point of the stimulation and record a single contraction and label it as a 1, and the first few contraction which is increase in the amplitude due to the beneficial effect. These first few contraction 1, 2 and 3 is increase in the amplitude due to the beneficial effect. As the stimulation is continued, there is a progressively increase in the latent period and decrease in the amplitude or the height of the graph. Now, switch on the drum and record all the subsequent contraction until the muscle fails to contract. Then stop the drum and place the stimulating electrode directly on the muscle and rotate the cylinder by the hand so that the stylus touches the paper just ahead of the graph. Then tap the contact spring with the finger so that the single induction shock is delivered directly to the muscle, and such type of the contraction is labeled as a direct stimulation of the muscle. Okay, then we have to stimulate the sciatic nerve once each at a time at the interval of 3 to 4 minutes to determine if there is any recovery from the fatigue by the stimulation of the nerve or not. Then finally muscle fails to contract all the together and the liver does not return to the baseline. Here we can see this graph is not touches the baseline as the muscle remain in the state of the partial contraction, and such type of the contraction is known as contraction reminder. Okay. What is the site and what is the causes of the fatigue in the nerve muscle preparation? So there is a three possible site of the fatigue. One is the nerve fiber, second one is the neuromuscular junction, and third one is the muscle fiber. The fact that the nerve is practically unfatigable and that the direct stimulation of the muscle causes the contraction, which indicates the neuromuscular junction is the seat of the fatigue in very artificial preparation, which is a no blood supply. Okay. Now, what are the possible causes for the fatigue? So, the cause of the fatigue is depletion of the acetylcholine from the motor nerve ending and interference with the neuromuscular transmission by the substances like pyruvic acid, lactic acid, and the breakdown product of the ATPs. It can be shown that the nerve is not the site of the fatigue by bringing the nerve of a fresh preparation in contact with the nerve of the fatigue preparation. So here we are prepare a nerve in a two way. One is the nerve of the fresh preparation and one is the nerve of the fatigue preparation. Now, the second muscle responds to every induction shock while the first one does not. The first nerve merely acting as an electrical conductor, and the recording of the external potential from the first nerve can also be shown that it is not the seat of the fatigue. Okay, and if the direct stimulation of the muscle is continued, fatigue occurs due to the exhaustion of the glycogen, and there is a no recovery from the fatigue in such type of the cases. Okay. How is the fatigue studied in the mankind and what is its possible causes? Okay, so fatigue in the man is studied by the Mozos ergograph. Here we have to remember name of the ergograph is Mozos ergograph. Okay, in which work is performed by the finger and the thumb in lifting a weight, and the effect of the stimulation of the median nerve and of the occlusion of the brachial artery can also be studied. Okay. what is a contraction reminder and what is its causes. A delay in the relaxation period is an early sign of the fatigue, and when the fatigue sets in, the muscle is unable to relax fully and remains in the state of the partial contraction. So here muscle is unable to relax fully and remain in the partial contraction, and such type of the contraction is known as contraction reminder. Now what are the possible causes for the contraction reminder? Since the ATP, by removing the calcium ion from the cytoplasm, is responsible for the relaxation, and a decrease of the ATP and accumulation of the metabolites appear to be responsible for the inability of all the myosin heads to disengage from the active site of the actin filament. And such type of the phenomenon also will compare with the rigor mortis. Ability to sustain the fatigue. So fatigue is the inability to maintain the force generated by the muscle, and there are two possible causes of the fatigue. One are the central causes and second ones are the peripheral causes. Okay, so central causes of the fatigue include the failure of the transmission of the information from the motor cortex or other cortical areas to the muscle. However, central defects for the fatigue are the very rare. Okay. Now, what are the peripheral causes of the fatigue? It include, one is the impaired neuromuscular transmission. Second one is the defect in generation of the action potential in the muscle fiber. Third peripheral causes of the fatigue is decreased excitation contraction coupling, and fourth cause is decreased availability of the oxygen or the glycogen to meet the energy requirement that impair the ability to generate the force. Fatigue developed during the isometric exercise like weightlifting is totally different from the fatigue developed due to the isotonic exercise like jogging. Fatigue in isometric exercise. Fatigue in the isometric contraction is a high frequency in nature. Okay, it is a high frequency type. In maximal effort of the isometric exercise, all the muscle fiber, including the fast twitch fiber, are recruited repeatedly. In fast twitch or the glycolytic muscle fibers, fatigue occurs within a second to minute, and this is due to, one reason is immediate decrease in the glycogen, second reason is decline in the pH locally in the muscle, and the third reason is impaired conduction of the action potential along the muscle fiber due to the accumulation of the potassium in the T tubular system that comes from the extracellular fluid. Okay, and this high frequency fatigue lasts for a short duration. Therefore, the muscle can generate the another isometric contraction which is following the previous one. And however, if the contraction occurs in the quick succession, the maximum isometric tension develop decrease gradually. Okay, and like training has a little effect on the high frequency fatigue. For example, when the weightlifting can enhance the muscle strength but cannot provide the resistance to the fatigue. Okay, fatigue is due to isotonic exercise, and fatigue is due to isotonic contraction is a low frequency type, while the fatigue which is due to isometric contraction, it is high frequency in nature. Okay, so here in isotonic exercise, this is occurs during the repeated isotonic muscle contractions that mainly recruit the slow twitch or oxidative fibers. Second is the frequency of the motor neuron discharge to cause the fatigue is much less than the frequency required for the maximal isometric contraction. Fatigue develops slowly over a period of many minutes to hours, which occurs due to impaired excitation contraction coupling following the depletion of the intracellular calcium. And the training for the aerobic exercises impart resistance to low frequency fatigue and therefore promote the exercise induration, especially when the moderate effort is repeatedly applied to perform the exercise. Thus, The training enhances the performance and decreases the fatigability. Carbohydrate diet prior to exercise postpone the fatigue in the runners. The time of the onset of fatigue during the exercise largely depends on the amount of the glycogen stored in the skeletal muscle, especially in the muscle of the leg prior to beginning of the exercise. In a normal well-built individual, muscle glycogen stored average about 15 to 18 gram per kg of the muscle, which is reduced to about 3 gram per kg of the muscle after the marathon running. Okay. So, to avoid the early onset of the fatigue due to the muscle glycogen depletion, the runner should have more muscle glycogen at the beginning of the running. And as the diet is the main source of this glycogen, so consumption of the carbohydrate rich diet few days or at least a day prior to the competition will increase the resting muscle glycogen and delay the onset of the fatigue in the marathon runners. Thank you.